Well, we got about 500 participants on board. We're expecting, well, we're about halfway through. We're going to go ahead and get started. I don't know if you all have noticed, but Cuban time has seemed to disappear. It disappeared in Miami because all these Zoom meetings start exactly on time. Anyway, thank you for your patience, everyone, and thank you for being part of another Chamber Roundtable. As I said, I'm Alfred Sanchez. I'm the president and CEO of the Greater Miami Chamber. As our nation begins to laying the groundworks and plans for opening up our economy again, our state and local governments are busy laying the groundwork and guidelines for exactly how we're going to do that, when, and how we're going to do it safely. We're lucky to have with us today our county mayor, Carlos Gimenez, and the mayors of our two largest municipalities, Mayor Dan Gilbert from Miami Beach and Mayor Francis Suarez from the city of Miami. We're going to talk about the plans that they will have, especially in light of the governor's announcement yesterday to open up the state in a step-by-step process. I know we're all wondering what it's going to mean for us, what it has in store for the greater Miami area, and how exactly you and your business is going to be able to get up and running. And hopefully we can have a great conversation today about that. As the hallmark of our program has always been, it's about the sorry, we're having a little technical difficulty behind the scenes. It's about the conversation and the questions that you're able to ask, and that's really the major part of our roundtables. So, in order to do that, I want to lay some ground rules so we can have an efficient meeting. First of all, in order to manage the conversation, all the participants are going to be muted throughout the presentations. There will be a question and answer session after each segment. We're going to talk to Mayor Gimenez first and talk about the county and take some question and answers then. And then we'll move on to the municipalities and have questions and answers after the mayors Suarez and Gilbert get a chance to talk. In order to do so, in order to get your question in, I want you to do this. At the bottom of the screen, there's a Q&A tab. We want you to use that, type your questions in there. Only questions in the Q&A are going to be answers. If you want to have general comments, a quick clarification, if you want to communicate with one another, you can do that through the chat room. Only questions, again, that are in the Q&A are going to be posed to the panelists, so make sure that you write them in there. Your questions will be read by our meeting administrator and our moderator throughout the process. So please really make sure that you write those questions in there. Now, we're probably going to have a lot more questions we'll have time to answer, so behind the scenes, we have a panel of experts that are trying to busily answer a lot of your questions just online. So please make sure that you follow whether or not you're getting a written written answer to your question. All right. So before we begin, I want to be able to recognize the fact that we have a lot of our sister chamber members on this webinar, and in order to be a part of the discussion, we really wanted to get the word out. And so we went to my very good friend, Mark Trowbridge, who besides being an expert at running his Coral Gables Chamber of Commerce, also serves deftly as the president of the Coalition of Chambers that really gathers us together. And through this process, Mark has done an incredible job of gathering us and sharing information. And Mark, I want to thank you for the help that you've been giving all of our chambers and the leadership that you've been providing. And I want to give you a chance to say a few words about the coalition that I don't think a lot of people know about. Mark?
Alfred, thank you very much, and greetings to all of you on today's Town Hall Zoominar. It's an honor to be with you, and as Alfred mentioned, for the last decade, I've had the great honor of working so closely with many of our chamber leaders here in Greater Miami. And for the last 5 weeks, we have convened as a group, about 15 of us from the southern points of our county in South Dade all the way to Aventura, and all points in between, to talk about issues affecting all of you on this call, our local businesses, our mom and pops, our small businesses, and of course, those of you that are so dependent upon the consumer who has been noticeably absent from much of what we are trying to do. But all of us have been very focused in staying in connection with our chamber leaders and you, our chamber members. As I mentioned, about 15 of the local chambers have been a part of this conversation each week, and we have focused on everything from how we can work together, be more collaborative, focus on things like the Paycheck Protection Program and the CARES Act, both the first round and the second round. And of course, we're very thrilled to be joined today by three of our mayors here in Greater Miami. Their leadership has been very key. Many of them are leading efforts related to the reopening and recovery of our economy. We are doing the same here, not only in Coral Gables, but looking at what our partners are doing and trying to employ all of those best practices. So I think where I will leave it today is keep your chin up, keep your focus honed. Know that while we have been socially distant for some time, your chambers have been working collectively and collaboratively to keep us socially engaged and keep us ready for the moment when we can phase in for a safe and healthy recovery. We are going to be there for each other. And I will say this, as I have said to our presidents at each meeting, this will be, together, our finest hour. Thank you.
Thank you, Mark. A vestige of Churchill. You know, Mark, if you know him, he's a wonderful historian. Mark, I really want to thank you for the leadership. We're very, very lucky to have you a part of our community and part of the leadership of all our chambers. You know, the chambers are really, I keep calling them in this war against COVID, our citizen soldiers who are our boots on the ground, really trying to do the very best to help our business community stay up and stay healthy, and in this opening up process, help them through that as well. Before I introduce our moderator, I see that Mayor Carlos Gimenez has joined us. Mayor, welcome. I wanted to just say a couple of things because I've been very lucky to be a part of the Economic Recovery Task Force that you put it together, looking at the different industries and how they're going to go open up. And I wanted to say publicly that that process has been extremely well thought out. If anybody thinks that you haven't been involved in this at all, you've been intimately involved in all of the reviews and development of these plans. And I got to say, we have been very lucky to have someone who has been directing this, who has made doing it safely paramount. I want to thank you for that. And we'll get to your comments in a second, because our very good friend and chair of our Government Affairs Committee, Jose Bermudez, is going to moderate our discussion with you, Mr. Mayor. And I wanted to let everybody know that not only does he work for us as the chair of our Government Affairs Committee, but we actually let him earn a living every once in a while by doing this professionally with a firm of Pereira and Reyes. If you know those names, you know that they're bastions in advocacy and lobbying. So, Jose, let me give it back to you and take it away.
Thank you, Alfred. And I'm very proud to have two full-time jobs, one at the chamber and one consulting and fighting hard for our community. But I wanted to take this opportunity to thank personally the leadership of Mayor Carlos Gimenez. It seems that every single time a Miami-Dade County mayor in a tough situation gets called into action, we are the quickest at responding and ensuring that our residents in Miami-Dade County are safe. And really, Mayor, congratulations on a great effort. I know we seem to be halfway there because we have been able to stop the curve, and now we're finally envisioning the continuation of the economic recovery. And this forum really is about how do we reopen South Florida. And you have been working, I've been seeing you in the news almost every 5 minutes. You have been working with our federal partners, our state partners, and also with the many municipalities in Miami-Dade County, and also working with our partners in the South Florida area with Broward and West Palm Beach and Palm Beach counties. This forum is really to talk about what the next steps are for South Florida. How do we reopen our businesses, and how do we get back to normalcy? So the floor is yours, Mayor, and thank you so much. Mayor, I believe you are on mute. If you could please unmute your screen. Hold on.
Okay, can you hear me now?
Yes,
Can you hear me
Mr. Mayor. Yes, sir.
Yeah, it's technology. Sorry. Uh, I just went through thanking you guys and telling you how great you are, and you didn't hear it. Oh my God, I can't believe that. All right, but thank you to the Greater Miami Chamber, Jose. Thank you, Al. Thank you again for holding this interactive roundtable to discuss the plans for reopening of South Florida. You know, I know that we're all looking forward to moving to a new normal, and so that people can get back to work. I know I certainly am. In Miami-Dade County, we took the first major step toward that goal yesterday, and we opened up the outdoor spaces, including our parks and our waterways and golf courses. This is a way to show the residents of Miami-Dade that there is a light at the end of this tunnel. You know, I went out and checked on various locations, and I was pleased to see that people, our residents, are basically following the rules. We have invested heavily in making sure that there is enforcement in these outdoor spaces so that we can continue to tamp down on this virus, and enforcement is the key. The physical and mental health of our 2.8 million residents is my top priority as we confront this virus. Medical experts agree that people need fresh air, they need sunshine and exercise to really, thrive in these challenging times. And so we decided to open these outdoor spaces after consulting extensively with our health experts at the State Health Department, Jackson Health System, UHealth, and the medical schools at FIU and They had complete buy-in into the program and the process that we initiated that led to opening of these parks and marinas and golf courses yesterday. They helped us set the health and safety parameters for opening up those spaces, including the use of facial coverings, strict social distancing, and frequent deep cleaning of high contact surfaces. We also worked extensively with our coastal communities, the League of Cities, officials in Broward, Monroe, and Palm Beach counties to make sure that we have coordinated approach to reopening that is clearly understood and communicated throughout the region. It wasn't luck, it wasn't coincidence that Broward and Palm Beach announced the same measures, basically the same measures at the same time. Now I want to stress that my executive orders for the county set the minimum standards. That means we allowed cities to open their parks, but municipalities may decide to not open city parks or only open some of them. Some cities may not have sufficient enforcement personnel, and I said that's really critical, and the enforcement personnel on hand to assure that the rules are met. This can add to some confusion for residents, but overall, many, if not most, of Miami-Dade County cities have open parks, golf courses, and other public spaces using our guidelines. And like I said before, and part of the process is the Miami-Dade County League of Cities and also the Managers Association. They're completely entrenched in our process. So it's important to get the right information before you plan to head outdoors to a park, marina, and golf course to make sure they're open, and check out miamidade.gov new normal for all the details. Now we're expanding our scope from outdoor spaces to begin strategizing ways that we can move and start moving towards opening interior spaces, including non-essential businesses and cultural venues. The open space working group that included our medical experts helped us kind of to develop a framework that we're using right now as we move forward to the interior space initiative. By having healthcare experts team up with business professionals, we ensure that each group brings a balanced perspective. And what I mean by that is it makes no sense for non-medical personnel or only medical personnel to be inside the group, because we may come up with regulations that actually is unworkable for the business community. And so we have to have a balanced approach to this, something that'll work for the business community while at the same time making sure that we keep our community safe. Public health is at the center of this initiative, and as we develop specific plans on how businesses can reopen. The county's interior spaces working group covers restaurants, museums, and cultural venues, small businesses, retail shops, factories, malls, office buildings, trade and logistics, hotels, and everybody's favorite, personal grooming businesses. That's the #1 complaint that I get. Yesterday, Governor DeSantis announced plans to open up many businesses in the rest of the state based on the number of COVID-19 cases that they're experiencing. The exception to that order is South Florida, where Miami-Dade, Broward, and Palm Beach counties are working together to contain the virus and develop plans. The good news is that we're flattening the curve here in South Florida. The number of hospitalizations has been steady for more than 2 weeks, and this is helping us move to this first phase of openings. As a member of the governor's Reopen Florida Task Force, I can tell you that we have been working hard to open up in smart ways that take into account medical experts' advice every step of the way. I want to thank the governor for his leadership and flexibility as we continue moving to a new normal. In Miami-Dade County, our working groups are data-driven. Epidemiologists and infectious disease experts, as well as the Florida Department of Health, are part of each one of those groups that have also industry experts for that particular business. The county is also hiring a consultant to track all the public health indicators from testing availability to hospitalizations. And by the way, we have some of the best data of anywhere in the state and probably in the country, because we mandated that our hospitals give us additional data to help us track this virus. The data that's really critical is how many people are going to the hospital, how many people are using ventilators, how many people are in ICU. And I can tell you that the number of people in the hospitals has been steady or declining. The number of ventilators that we have available has been steadily rising. The number of people that are coming into the hospital with COVID-19 has been steady or declining. So those are all really good signs. And that's information that we get every single day. We don't have to rely on the state. As a matter of fact, the state takes our information for some of their decisions. You know, this will enable us to open up certain businesses at the right time with the correct health protocols. This will mean that social distancing and the use of office coverings or face coverings will not go away anytime soon. In order to continue to tamp down the curve and eventually lower the infection rate, we have to move methodically based on the best medical advice. I know that we all want to get back to work and open businesses. I certainly do. The key drivers for our local economy are the airport and the seaport, and we're working with federal and state officials to see how we can start to open more flights in a way that's safe for passengers and employees. And that as it is, the airport and seaport are crucial right now for food and medical supplies for Miami-Dade County, as well as the nation and for our entire hemisphere. It's important to keep in mind that certain businesses may not have to wait or may have to wait longer than others to open because of the nature of their business. If there's close contact between customers, that's going to be a problem. And I say this because you may have heard me repeat this over and over again. Everyone has to act as if you have the virus. In fact, our study has shown that a lot of people have this virus and don't even have any kind of no kind of symptoms. The reality is, again, that most of the people we have tested positive for the virus are not experiencing any symptoms whatsoever. It's dangerous for those folks who are at high risk, such as our seniors and people with lung disease, diabetes, compromised immune systems. That's why social distancing and using masks in interior spaces, along with constant hand washing and disinfecting high-touch areas, is so important if businesses are to open again. The county has provided test kits to the University of Miami for a random study that will check for those who have antibodies to the virus. What UN researchers have found so far confirms what I've been saying. Many more people have the virus than the 11,000 or so that have tested positive through our medical test sites. In fact, there are anywhere between 123,000 and 221,000 county residents who have the antibodies to the virus based on this study. And more half of them told the again that they never experienced any symptoms. So we must keep that in mind as we prepare plans to eventually open businesses. I also want to reiterate that any business openings in order for the county set a minimum standard. But again, if your business is located in a city, that municipality can decide to not open certain businesses in their city, even though similar businesses could be open in the rest of the county. Cities cannot allow business to open without the county doing so first. Let me reiterate that again. A city cannot allow a business to open without the county doing so first, but they can decide to keep them closed. So you must make sure your city officials are aware of the needs of your business and your customers. The working groups and the medical experts are going through all the steps that will be required to make businesses safe to open again. These new procedures will be very clearly explained to business owners, workers, and customers. And they will also be standardized as much as possible across industries so people can easily adapt to a new normal. It'll also be a lot like life right after 9/11. We will be making it as easy to understand as possible. We will also know that the steps we need to take to prepare our businesses to open and to prepare workers and customers to enter those facilities. And just as we are doing with outdoor spaces, enforcement will be a key to the success of the interior openings. We will take corrective action if protocols aren't strictly followed. We still have some work to do, but we're off to a very solid start with these groups. There is light at the end of the tunnel, and I'm looking forward to getting there as soon as possible with your help. We held virtual meetings with each of the interior spaces working group this weekend. We're now ironing out the details to make sure they follow the protocols recommended by our health experts, and also how they align with the governor's message yesterday. With each step along the way, we rely on the input of our healthcare experts. And I want to reiterate that very much. We rely on the input of our healthcare experts, our business owners, our community partners, organizations such as the Chamber of Commerce, and all the people participating in today's interactive webinar. As always, health continues to be our top concern. Our working groups will be making rules to keep people safe both outdoor and indoors, but it's still up to everyone to take personal responsibility. As we adapt while moving to a new normal, our new motto is, I keep you safe, you keep me safe. That's the mission we're working on together. And now I'd like to hear from you and answer any questions that you may have. Thank you.
Thank you, Mr. Mayor, and thank you for your leadership and ensuring that we have a centralized voice for all the concerns. I know that there's different restrictions as it comes to the state and some of the local governments, but you have been a voice to help get that message unified. We have several questions that have been submitted to not only this group chat, but as well prior to this webinar. On several steps that the county is taking to reopen and go back to normalcy. As you know, you mentioned Miami International Airport being the largest economic driver in our community. And after 9/11, there was an increase in security measures put in place with new TSA regulations. What do you foresee will be some of the changes in some of the checkpoints and as international travel starts to open up once again to help bring confidence back to our travelers into Miami?
Well, one of the things that I wrote a letter to the president asking that once testing becomes available, especially this rapid testing becomes available, that any international traveler coming from a hotspot be tested prior to boarding the plane. Even though they've been cleared, et cetera, they need to be tested before boarding the plane for the antibodies. And if they have the antibodies, they shouldn't be allowed to get on the plane until they're proven to be negative in one way or another. That will greatly reduce the incidence of infection coming over. A lot of people put a lot of stock in taking temperatures and talking to people. But as our studies have said, the vast majority of the people, especially when they're actually contagious, right, don't have any symptoms. They don't have a temperature. They're not sniffling. They're not coughing. They're not doing anything. Okay, and so 70% of those are actually getting through. And so it's much better to test them at the point of origin when those testing kits become available. They're relatively cheap, and before they get on a plane, before they come over here. So that's what I've asked the president to do, and that's also I think what the governor has asked the president to do.
Thank you, Mr. Mayor. Sticking to the point on Miami International Airport, there are several vendors and concessionaires that have seen a decrease in passenger travel and foot traffic in the airport. A lot of those currently have what is a MAG. That's how they pay rent to the county. What kind of relief could be offered from the county to those folks that have seen a drastic reduce in foot traffic at Miami International Airport?
Yeah, it's a 95% reduction. It's not just a little bit. We're down to about 5,000 passengers a day versus 120,000 passengers a day. That's how much this has really hurt. And obviously we're at 0 cruise passengers at Port Miami. And that's 70% of the income to Port Miami comes from our cruise business. And so this is hurting a lot. We know that our concessionaires are also hurting. We, the county commission, we've made some recommendations to the county commission on how they can help them, and please call the airport director directly, okay, to get the information on how we can help them with their particular business at Miami International Airport. But we understand their plight, and we're here to help them. We are going to help them.
Yes, and definitely a big shout out to Miami-Dade County employees that have been working arduously 24/7, getting to the concerns not only of our business committee, but our residents as well. You talked a little bit about Port Miami, and I want to ask you, are there significant delays in some of the goods that are coming in from the cargo, both at Port Miami and Miami International on the cargo side? Are there additional inspections, and has that created any delays for goods?
Well, on the flip side, we've had a 95% reduction in passengers, but we've had an uptick actually in cargo. A lot of these airlines are actually taking seats out and putting cargo in. there's more cargo coming into Miami International Airport. We've had a slight decrease in cargo at Port Miami because some of these cargoes coming from some of these countries that are shut down. And so, but not to a point, not to the same level as 95% at MIA. Probably somewhere to the around 10% maybe. So there's still a lot of cargo coming in and out of Port Miami, and there's a lot of international air cargo coming into MIA.
Great, thank you. Governor DeSantis recently appointed you to a task force with several leaders throughout the state in how to get back to work and get back to the normal. And recently we saw that Governor DeSantis exempted Miami-Dade County, Broward, and Palm Beach as part of that first phase of reopening. What was your primary goal as being part of that task force, and what do you see are steps that Miami-Dade could take in order to get back and be aligned with the rest of the state?
We're not going to be aligned with the rest of the state initially, because the rest of the states, what's happened at the rest of the state is not the same thing that happened in these 3 counties. And so the rest of the state's going to be a little bit ahead of us. We want to be as little, I mean, we want that gap to be as little as possible. But the governor knows that he can do certain things in other parts of the state that he may not be able to do here in Miami-Dade. We're in complete agreement with the steps that we need to take. Whatever comes out of our task force, everything that's been coming out of our task force is actually going back up to Tallahassee. And so maybe we can blend these things. And so they're getting the benefit of the input of what we're doing. We're also getting the benefit of the input of what they're doing. And so helping our committees. And so we want to blend this together. The governor and I are in sync. Exactly, what he did yesterday was exactly what he needed to do. He knows that this tri-county area, including Monroe, needs to be a little different, even though Monroe doesn't have the same cases that we do. But we need to be a little different, and we need to take our, take our time as we go through this. Look, a good example would be opening beaches. There are stretches in Florida where there are very few people, and so there's no reason to close the beaches. Miami Beach is different. Miami Beach, our beaches are a heck of a lot different, a lot more crowded. And so we have to take different steps to open up our beaches than he would have to do somewhere else in the state.
Thank you, Mr. Mayor. It certainly does make a strong case in support of home rule, but we keep on fighting that in Tallahassee every year. I've had a lot of questions about folks that may not be showing symptoms, may not feel that they have any illness, but need some assurance. I know that the county has set up different drive-through sites throughout the county. What are the current regulations in order to be tested? There's folks that certainly, in order to participate and go to some of the parks, feel the personal responsibility that they need some assurance that they are negative before they could leave the stay at home and go participate in other recreational activities. What is the current regulation for someone that may not show any symptoms or may not have a prescription on the doctor?
If you don't have symptoms right now, I mean, you used to have an age restriction. You have to be 65 years and older and have symptoms. Now you don't. You don't have to have that. There's not that age regulation anymore, but you have to have symptoms because we still have a finite number of tests, and those tests take personnel, trained personnel to administer, and got to go take it to a lab, and then there's just certain capabilities. As more of these antibody tests become available, that's going to be the key to be able to open up more and more of our spaces, I believe. They're quick, they're relatively easy to administer, and you get the results back in 10 minutes. That's going to be the key. We don't have enough of that yet. We're using that right now for our medical study with the University of Miami. It's a randomized test. We call you, come in, and we'll test you. That really tells us where this virus is at here in the community. Hopefully, we'll get more and more availability of these antibody tests that'll be easy to administer, and that more and more of our people can get it. But again, look, you have to assume you have it. You have to assume you have it, all right? And you have to assume that everybody around you has it. And that's why you put in social distancing. That's why you wear a mask. That's why you wash your hands. That's why you stay away from people. And unfortunately, for a while, that's going to have to be the norm because it's very, very difficult to try to test 2.8 million people. And as soon as the test is over, you can get infected. Okay, so we have to take personal responsibility. It's a great tool, and it's a great tool to try to drive down the probability of getting it, but we still have to take personal responsibility and take the measures to protect ourselves and our loved ones.
Great. Thank you. And as we head back to normalcy, there is going to be schools have been suspended for the remainder of the year. I know a lot of parents are at home doing their best to teach their kids the curriculum to finish out the year. But as we start to reopen, there's going to be a month gap that these kids may not have a parent to take care of them. What are we thinking anything about providing childcare or childcare assistance to some of these parents that may need to go back to work?
Well, childcare has never been closed. There are rules on childcare. The problem was that most parents use the school as childcare, right? I mean, they take their kids in the morning, they go to school, they may leave them after school, they pick them up on the way to work, and there may not be enough childcare facilities to do that. We're trying to work to see how we can help in that manner. The problem again is you do this in mass. You let's say, after school, or you do summer school, or you do summer programs at parks. Usually you got a bunch of kids together with a teacher, and that's not what we want to do to try to beat this virus. We don't want people together. We want people kind of separate. So the virus is actually a big challenge to how we can help those folks that need some kind of childcare. It's not an easy solution.
Okay, great. Recently, you called on the Miami Dolphin organization to assist you with getting some security personnel. These are folks that were displaced because obviously there are no special events taking place at Dolphin Stadium. And that was a great collaboration in how private sector could assist the public sector. And you were able to obtain 400 employees that otherwise would have been furloughed or without a job. And they are right now protecting our parks facilities and our boat ramps and ensuring that social distancing is happening. There is another phase of our process, which will require healthcare trackers. That could be a large number of new employees that will be needed in order to get back to normalcy in Miami-Dade County. Are there any steps that the county is taking to maybe call on some of the other industries that may have employees that can't return to work but may be suitable to be these healthcare trackers? And can you talk about the tracking program?
Well, the tracking program is a function of the Florida Department of Health, and we extend our hand to the Florida Department of Health in any way that we can. Right now, we have a number of librarians, over about 800 of them, libraries aren't open. We're using some of them for these 26 sites where you can pick up these applications for unemployment and all. So we've offered that to the state on a number of occasions, these hundreds of people that we have to do that. The security personnel that we hired, it wasn't given to us by Hard Rock. These were folks that were out of work. There were about 1,000 people out of work. And so they're already trained in security aspects. So we talked to the company, hey, we need about 400. Can you give it? It took about an hour to get the 400, all right, that they wanted jobs. And so, and the reason we did that is because the only way all of this works is with enforcement. Yes, 90%, 95% of our residents are going to follow the rules, but there's always that small percentage that doesn't. And then it ruins it for everybody else. And so we're not going to allow them to ruin it for everybody else. We're going to enforce it, all right? And the only way to do that is to have additional personnel. In terms of tracking, we will help the Florida Department of Health in any way they want. We also are looking at technology to be able to do that. And there are some new exciting technologies that are coming out that make it much more automated, easier, phone-based, app-based tracking mechanisms that we're looking into and developing partnerships with other universities to be on the forefront of that.
Great. Thank you, Mayor. I don't know if you've noticed, but we are actually in an election year with all these news about COVID. nobody's really talking about elections, and I particularly like it. But there certainly is a presidential election, and that is something that's going to create large crowds. I know in large areas in our community there are
Oh,
2-hour lines.
no, they may not create large crowds. Okay, don't assume that. Okay, large
But
crowds
are
right
there?
now, large crowds are forbidden. Okay, so don't assume large crowds. Okay.
No, but definitely as we move towards the primary, are we doing any steps with the elections department to try to increase mail-in ballots, and what are we doing to
Yeah, we sent a, we're going to be sending a letter to every household that has a voter, telling them and advising them of the ways that they can avail themselves of vote by mail. We're not sending every single voter one, but we're sending every single household that has a voter this letter, and you can do it either by dialing 311. You can go on the website. You can send us an application or a form, and then we'll send you the application for vote by mail. But that's being sent to every single household that has a voter in Miami-Dade.
And we definitely encourage the Miami-Dade citizens to take advantage of that opportunity. It's very easy, and certainly does take some strain off the county. We have time for one last question, and this one is one that is coming from our development community. Many of us have been driving down the streets, and they have been empty. Has the county taken advantage of the fact that all the population is stay at home, under a stay-at-home order? Has the county taken advantage of that in order to expedite certain capital projects and infrastructure projects that otherwise would be a lot more difficult due to road closures and those situations?
I don't have the answer to that, but I would hope so. And none of our projects have been stopped, and so I would assume that our projects are being accelerated because there's not much traffic on the road. So I've got to get with our public works department and other departments, our water and sewer department. Nothing has been stopped. Nothing has been slowed down. We've actually wanted to accelerate it and take advantage of the slowdown at least in traffic. But I can't answer that 100% for sure.
No, absolutely. Thank you. And we look forward to answering that question for the folks that are participating in this call. Mayor, once again, thank you for being part of this forum, and thank you for your leadership. And we really look forward to the message from the governor's task force and all the work that you're doing in the Tri-County area to help this community rebound. So thank you, Mayor, for your leadership.
Thank you all again for having this webinar, and this has been great. It's a new way of doing business. At least that's one good thing that came out of this, right? That we can do this much more often. I can talk to you and talk to your members in a much more personal way, and a lot more often. So thank you again for putting all this on. I know it takes effort, and look, there is light at the end of the tunnel. We are working on it. And I can't give you a date, so nobody else is going to be able to give you a date. All right. We're working on it, and then we'll put out some pretty good regulations that everybody else can follow. And again, like I said, cities can be tougher, but they can't be any more lenient. And they can open once the county says it's okay to open. Once the county opens up, then the cities can open up. Some of them may decide not to. So it's up to them. Okay. So God bless all of you and have a good one. I am off now to another webinar, which is now we're going to work on the food industry, the restaurant industry, the most exciting one of these committees that I have, hottest one, back and forth. So I look forward to it. Yeah, and I'm going to take my coat off because it's going to be a hot one.
Well, Mr. Mayor, thanks. And we look forward to going to our tattoo parlors again.
Don't count on it.
Thank you, Mayor.
By the way, haircut, okay? It's gonna be real difficult. Okay, the number one thing, man. I get hammered at home every day. When are you gonna have the hairstylist and the haircuts? All right. So yeah. So there's pressure here at home about it.
Yeah.
Do it yourself. Do it yourself.
Oh, it's not gonna be pretty.
Well, thank you, Mayor. Thank you, Mayor. And now we move over to our our great mayor of the city of Miami Beach, Mayor Dan Gilbert. Thank you so much for joining us. As you can tell, we've had a very lively discussion with Mayor Gimenez, and really he has been shedding some light in what's taking place at the airport, seaport, at our hospitals, and the various testing centers throughout Miami-Dade County. But we talked a lot about local actions and what our local government's doing. So I'm going to turn over the floor to you. Tell us a little bit about what's going on in Miami Beach and what are some of the next steps that you guys are taking to help reopen South Florida.
So, it's a very interesting challenge, obviously unique to everybody. And just following up on what Mayor Gimenez said, the only inviolate lesson I've learned in all of this is don't try to give yourself your own haircut. It's a very bad idea, as you can tell from me. We can't simply put any of us in our own little shell. What the state announces, which in many respects follows some of the federal guidelines, is then, as you can see yesterday, the governor said, well, we're doing this for the state and we're going to start phasing things in, but of course we're not going to be doing this in South Florida. We're going to sort of let them go at their own speed with local mayors. And what Mayor Gimenez will be able to announce is he'll sort of control the speed of things, or at least the minimum speed, in a sense that or the maximum speed, depending on how you look at it. Whatever he announces, will then mayors will be free to be more stringent or more or slower, but not faster. And that's fine, frankly, because I don't think there's any real chance that we would want to go faster than the county in any respects. And we're going to follow that. We have been advising ourselves, my commission and our manager, Jimmy Morales, really with the help of lots of different folks, but first and foremost, it's a healthcare crisis. We've been talking to doctors. We talked to Dr. Marty, who's the same doctor at FIU that the county is using. We talked to a doctor at the University of Miami. We've got a group we're dealing with at University of Florida who does emerging pathogens. We deal with actually talking to a fellow at Duke and his team who are in the same area. We're, to a certain extent, it's hard for a city that doesn't typically have a bandwidth of healthcare experts to do this, but we are trying to make sure. And what's unique about, as everybody knows, in our community is that, and I mean our community, I also mean a community that includes all of Dade County and my friend Mayor Suarez's community as well, that we're a little different than other areas of the world. It's just we have a different normal, frankly. There are not a lot of places that I'm 92,000 residents on Wednesday, and I could be 300,000 on Friday night. We get 10 to 15 million visitors. We get an enormous amount of people, 4 or 5 million from international visitors, from cruise ships. I always say we are not built for social distancing. We're built for the opposite. We want big fairs, big art fairs. We want Super Bowls. We want gatherings and weddings and all sorts of things that don't do very well with social distancing. And we're built for that with amazing restaurants, hotels, and all these other things. So our efforts to sort of open up are really going to be slower than the rest of the state, simply because if we open up the spigot, it's hard to control. And one thing we know is we can't do that without two things really happening first. The first is, according to the CDC, there's got to be a lowering of the amount of positives or some other metric that indicates that you're at the tail end of the epidemic. And the second thing that's very important is you got to have the thorough contact tracing and surveillance testing. The contact tracing is important for this reason. People don't really, I think, get why it's so important. At least some people don't. Let's say we open up and we get an outbreak. Well, we're going to have a couple choices. One of the choices is to simply recede and do exactly what we're doing now, shelter in place with very limits everywhere. The other option is to contact trace the outbreak so you can control it. You do surveillance testing so you know what's happening before it's too late and you have an outbreak. So those two things allow you to limit and to manage I guess is a better word, the bad bounces you're definitely going to get anyway. And the reason why that's so important in a place like ours is, and I want the hospitality industry especially to understand this, is that you've got to think in real time what is going to happen if there's an outbreak or there's a couple cases in a hotel or a restaurant or something like that. What are you going to do? And are you going to just, close everything down for a long time or what have you? There's got to be some protocol that is supported with technical capacity, including testing and an army of contact tracers who will be able to make sure that we're surgically dealing with the issue rather than what we've been doing. If we don't have that, then it really doesn't matter what goes on because every outbreak is going to become something system-wide. So that's really important. So we've been talking to doctors, we've been talking to our health department to see what their capacity is. A couple of good developments recently. We're going to have a testing site within a week, I think, at our convention center, which is now a field hospital. But that's going to be terrific because it'll give us more capacity. And the other thing is that Rockefeller announced that they're going to deliver to our community, mine and Mayor Suarez's and Mayor Gimenez's community, our entire area, some very substantial expertise in testing and contact tracing and in surveillance testing, and millions of dollars worth of resources and some of the best minds in the world to work with our health department and our community. So in terms of the thing that everybody wants to know is when are you opening up for business? I'll just say this. We'll open up for business at the first level, which will likely be retail and some level of restaurant, because that seems to be the first thing. When our doctors and our healthcare experts say, you have the ability to do that and manage what's going to happen. If we don't have that ability, then I don't know when we're going to. So that, that's the most important thing, is to have that in place before you do something, because what can't guide us is just frustration. That can't be your organizing principle. So, for us, we opened up our parks, not because we wanted to loosen restrictions, but for us at least, we found our boardwalk was getting very crowded. So the same day we accepted Mayor Gimenez's opening of parks, we also added a mask requirement on our boardwalk because we want people to socially distance, but in our city, there just hasn't been enough room to do it. So we're opening up parks for the purpose of mostly passive activity, other than I guess singles tennis. We are not allowing basketball, and Mayor Suarez is very happy about that because if he and I were to be playing one-on-one, it would be extremely embarrassing to one of us.
You got to invite my cousin JC Bermudez. He's got a pretty wicked shot.
It would be embarrassing to one of us, but I'm not saying which because I'll let him talk trash. I would never do that. But the truth is, so what we did is we didn't want really a lot of sports. We just wanted to give people more opportunity, and we in fact implemented not only the countywide mask requirement, but we did it on our boardwalk also, because right now we're not in the area of loosening things. We're in the area of getting through what is still, I think, the heart of this. And although our city, according to the Department of Health, has 700 or so infections, my colleague has about 7,000 at least, according to the Department of Health website. I think it's less, but clearly it's more than by multiples than anyone else in the state. So we're going to go about this slowly. We're not going to rush into it. And in terms of opening up, which is what your question, it'll come when healthcare people say it's ready. But I am at least giving our business community an opportunity to start preparing for that. We created some platforms for them to do that through our Miami Beach Chamber and through some other folks. Lyle Stern and Robin Jacobs, the chairman of our own Chamber of Commerce, agreed, along with Emilio Estefan. And we put a whole bunch of other folks on these panels to sort of advise us and to pressure test really the recommendations that are coming through from elsewhere. The good news is there are going to be a lot of ideas because every city in the world is trying to figure this out simultaneously, and every physician is doing the same thing. So there's a lot out there. I think for me, and I'll finish with this, is that it's very important to customize our countermeasures and our protocols and how we open up with the kind of city we live in. We are not Jacksonville, and we certainly aren't other areas of the country. We're an area that on any other day, these would all be our virtues. We open up Ocean Drive and we open up that segment of beach in Loomis Park. we know tens of thousands of people are going to flock there because why wouldn't they? And that's just not sort of an acceptable model right now. We have to get to a point where we can manage that, and there's just no way we can manage it. So we need to customize what we're doing for our community, and we only do that with the informed advice of healthcare professionals, the best that we can find. With that, I'll turn it over to anyone else who wants to speak, but I see Mayor Suarez is right below me, which is just fine.
So Mayor, before you go, we have a couple of questions that have been submitted by some of our members and folks that are in this chat. So if you'll humor us for a few more minutes. As a former employee of Miami Beach, and I had the great honor of serving under Mayor David Dermer. And during the time that I was chief of staff there for the mayor's office, we experienced a very tragic event, and that was the events of 9/11. There was a significant reduction in air travel, and Miami Beach is a city that largely or almost completely depends on tourism. What similarities do you see between both tragic events, and what would be your approach in promoting folks visiting Miami Beach once again when this is all over?
Well, I mean, you know, there are some similarities in that it did create an insecurity in air travel, which obviously had an impact, but the structure of our city and our community wasn't impaired. And obviously there wasn't this silent disease virus that could be killing people floating around. There were other things. And what you did see happen, and I was in the legislature at the time, and I was the vice chair of our 9/11 committee. So we did a lot of the countermeasures. We did put in place many things that were long-term preventative measures. We elevated a lot of the sharing that goes on between law enforcement, all the kinds of things that experts in law enforcement said you need to do to have a more robust and durable response. I think the same thing has to happen now because, you know, I get every day, and I'm sure Mayor Suarez gets every day, I get an email saying thank you, and then I get 2 or 3 calling me names I can't repeat on an open mic. You know, and people are frustrated, but at the end of the day, even if we were to open stuff up, you have to have a sense that it's safe to be here and it's safe to travel. And to me, I think the similarity is it's up to government and the private sector to create the protocols and the follow through and the durability and the robustness of those protocols. And some of them I mentioned earlier, so that people will come here, because a lot of folks are saying, just open up for crying out loud. And of course we do that. And let's say people do show up and let's say there's a spike and we're not prepared. Imagine how hard it's going to be then. We'll have to close and nobody will believe us when we say it's safe to come back. So we really got to get this right. And the only thing I'd say about 9/11 is there was a sense to make us more safe, but there was also a sense to let people know that we were safer. And that helped. And I think the same thing goes now. We can't just say we're opening up. We have to do things that make us safer so that people, and that will fuel our economy, because people will say they've got their act together in South Florida. We can go there and they know what they're doing. And until we're sure about that, until we put together until we've stood up the real system to do all this, it would be very short term, and we would end up, I think, hurting ourselves much more than helping ourselves.
Great, thank you for that. You were a former legislator and senator, and I think you possess a unique approach in having served in Tallahassee for many years, and you know the language over there. This past legislative session, several communities focused on resiliency type issues. What do you envision will be part of your city's legislative platform, and what ask will you have for Tallahassee come this 2021 legislative session to help rebuild your city?
Well, you know, look, one of the problems we have is that our city is this relatively small city that is very critical to the regions, if not the state economy. We are one of the primary contributors of sales tax in the state, probably only much different than Disney and Universal. And so we realize we have this burden of more than just taking care of ourselves. So I think the state is going to have to make sure that we're able to carry that burden if they expect they expect to have this hospitality industry return. We spend enormous amounts of money on all sorts of things like overtime for major events. We have to be a city that can turn a switch and go from 92,000 in the middle of the week to 300,000 on the weekend. All those things are pretty hard to do. So for resiliency, I think we've got to make sure financially that we're able to carry through. We've had to make some cuts and dip into our reserves slightly, but we got good news that our bonding level didn't change, and the rating agencies thought we had done what we needed to do to keep that intact. That said, I think the state has to pay attention, as the federal government does, to cities, and they really haven't at all yet. And of course, one thing that happens in a crisis like this is it reveals the fault lines of the way things work. I think the Department of Health, I like the fact that it's a statewide agency, but I'd like some folks down here that maybe have some reporting to the local community as much. They're a very nice group, but they report to someone in Tallahassee. And of course, in some kinds of challenges like this one, it's a little harder to navigate. And the last thing is, we can't forget the other long-term resiliency challenges we have. Sea level rise is still happening. This did not stop it. And I know Mayor Schwarz and I have been very vocal in pushing countermeasures and resiliency measures and durability measures with regard to sea level rise. And this is the kind of thing, because it does affect at least the financial part of it, as well as the attention we have on it. It can really have an impact. So for me, I hope that we start to get a little bit more attention on that, in which by and large the state and feds have not really done a whole lot on sea level rise in the local communities. That's been almost entirely local or regional, but not really state or federal. And I think they can't forget about that, because it's still a very pressing and obviously critical to all of us, not just for our property taxes and our tourism, but for our quality of life.
Absolutely, Mayor. We're getting a lot of questions from small business owners, and they are arguing that the state and the county has allowed for big box retailers and large gyms to reopen, but smaller gyms or smaller retail operations don't seem to be allowed to be reopened. And a lot of them feel that they could take on their personal responsibility on ensuring that safety and cleanliness could be handled. How do you feel? What timeline do you have for those small businesses? I know that a lot of them are anxious to reopen, and a lot of them will take that personal responsibility to be safe in doing so.
No, I appreciate that, and obviously we're all. I know there's been a lot of food lines set up, and we know there's enormous amounts of people in terrible conditions right now, and we really want to get them back to work so that they don't have to wait on a food line to get groceries for their family. But at the end of the day, I don't think we're nearly as fast as the state's going. So unfortunately, for a small business owner, we're not. I want to be pretty transparent. We don't intend on opening something up quickly. We are going to get as soon as we get the AOK, and we're going to at least watch what happens over the next week or two, I think, because frankly, we want to see what happens. We want to see if we're out of the woods. We want to see if we have the contact tracing and surveillance testing necessary to manage. Until we have all of that and we know it, I don't know that there's a whole lot of retail that's going to be opened up. And if it is, it'll be at a reduced capacity. I don't know that there is I haven't seen distinctions between sizes of business at this point, for at least in the documents I've looked at. I think it's more so about capacity, about whether restaurants are outside or inside, whether it's 25% or 50%, and then all the sort of details like masks and sanitizers and maybe temperature checkers and all these other things. So these are all the kinds of protocols we're developing. I haven't seen one that really sets out a smaller business, but by the way, some smaller businesses have bigger places, but some smaller businesses may have structural issues simply because if there's a capacity issue and you're looking at square footage as a metric of how close you are to somebody else, it may be difficult for a smaller business to handle what we say are best practices. Best practices will be built on best practices, not on sort of, unfortunately for I think a lot of folks, what is most helpful to energize commerce. Right now, we're setting up best practices based on healthcare concerns.
Mayor, we have one final question.
Yeah.
One final question. And during these times, what were your favorite 3 restaurants that you've ordered takeout in Miami Beach?
Oh, that's, something you cannot ask me that, okay? You can't ask me that because we have too many great ones. So I'm not going to, I refuse to answer that because then 100 others won't let me across the, when we do open up, won't let me back in, and I'm not going to do that. I'll let Mayor Suarez try to pick which of his favorite restaurants he goes to, but we have great restaurants, as does the city of Miami and our county. We've elevated our game, I think, over the last decade substantially, and I really pray that we get these folks back online because I'd like to get out of the COVID-19 and get into just eating again because I can go out, not because I'm stuck here at home snacking all day long.
Well, thank you so much, Mayor, for joining us. It's always a pleasure to talk to you, and thank you for all you're doing for our community, for your residents, and we look forward to visiting Miami Beach very soon. So thank you.
Thank you. And I'm going to listen a little bit until he offends me to the next guy.
I hope you will stay with us. Hope you will stay with us.
And what a wonderful transition into my mayor, Francis Suarez. As a Brickell resident, I got to tell you, Mayor, you have been doing an outstanding job in working with different organizations. I mean, seeing the DDA organize a DJ battle and keeping our very, very dense population sane is very important. So, Mayor, thank you so much for joining us. Thank you so much for your leadership. And I want to turn over the floor to you to talk to us a little bit about what the city of Miami has been doing, and you in particular.
Thank you, Jose. First of all, I'm going to try to offend Dan as quickly as I possibly can so I can get him off this call. No, I'm just kidding. But I'll start by saying his background is not quite as nice as my background. But as you'll know, we are now living in a new world and a virtual world. So this is my real background. I'm actually at home. This is my laundry closet. So that's the beauty of 21st century technology nowadays. So, we in the city identified this potential crisis very early on. Our fire chief actually brought this crisis to our attention actually before the Super Bowl, right around the time of the Super Bowl, when this disease, this virus was not yet even declared a pandemic, was simply an epidemic in Wuhan. And he started at that point ordering and purchasing personal protective equipment in the millions of dollars worth. Obviously, our commission stood unified in making some decisions proactively at the beginning of this process that hopefully saved lives, which was canceling Ultra and canceling Kyocho. Those both were festivals that, in the case of Ultra, was a festival of 150,000 people from 105 different countries. In the case of Kyocho, you're talking about a festival that usually has 250,000 people congregating. So almost 400,000 people congregating from so many different parts of the world. From there, we were one of the first cities, actually Mayor Gilbert was the first city, and I was pushing and getting some internal resistance on issuing a stay-at-home order. And so we issued a stay-at-home order very early on. We were the first city to implement a curfew. And we also were the second city after Miami Beach to implement a requirement that people wear masks at grocery stores, in banks, construction sites, pharmacies, and also the patrons also have to wear those masks as well. And I think because of that, our data indicates that our peak was slightly before both the state and the county, at least in the data that we've been given. Having said that, obviously, it has been an incredibly difficult circumstance for the residents of the city of Miami, as it has been for residents of all of Dade County and Miami Beach. And so what the city has tried to do is not just be proactive on the disease side, but we try to be proactive in testing. We were the first city to do in-home testing. We began it with seniors. Now we do in-home testing essentially for anyone who wants to get tested. We have essentially 3 testing sites in the city of Miami when you consider the in-home testing as one of the 3 testing sites. We're testing multiple hundred people per day. We're now testing people that are asymptomatic. I think we also should be testing people that are what I call post-positive. Because I think, in order to return to normalcy, we're going to have to, as Mayor Gilbert said, really ramp up testing and start thinking outside of the box with things like contact tracing to make sure that we are ensuring that our residents can go back safely to work. I've had so many conversations with so many people on this issue, and nobody can predict the future. What we're doing in the city is we're following, in essence, the experts that have promulgated a very specific gating criteria before we can enter into phase 1. And that criteria essentially involves 3 different factors. The first is a 14-day diminishment of influenza-like cases, a 14-day diminishment of COVID-19-like cases, influenza-like symptoms, so symptomatic reporting, plus 14 days of reduction in COVID-like cases. And then the third criteria is obviously an analysis of our hospital capacity. I think, based on the decisions that we've made, we've certainly been improving tremendously and dramatically in all of those areas. And we're continuing to consult with medical experts as well as the Department of Health in the state of Florida. I spoke to the Surgeon General this morning. I've had 3 conversations with the Surgeon General this week. And obviously listening to what all the other governments are doing and paying close attention to what other governments are doing. We obviously are very unique as a city. We're the densest city in Miami-Dade County. I think the 2 other largest cities, Hialeah and Miami Gardens, have similar issues to us in terms of their population. And even Miami Beach, frankly, has a lot of similar issues to us. And that's why I've been in constant communication with their mayors, very involved, obviously, through the League of Cities, as I was a former president of the League of Cities. So we try to maintain communication robustly with Miami-Dade County through the League of Cities, so that we can communicate what our issues are, what our concerns are, so that to the maximum extent possible, there can be a coherent strategy. That doesn't necessarily mean that we're always going to agree as elected officials, and that's part of life. You try to advocate what position you think is the best position, and like some elected officials will go along with it and others won't, and it is what it is. We do the best that we can for all our residents. One of the things that we're doing in the city, which I think is incredibly important, is we're trying to create a bridge for our residents right now. We know that there is we're in a scenario under which we're about to go to May 1st, and people are going to have to pay rent again throughout this crisis. This is the second month of this crisis, the second the second first of the month, right? Because this really started happening in the beginning of March in terms of the number of cases. I was case number 2, and I was diagnosed on March 13th. Our first case, I think, was March 12th. So this is the second first of the month that we're about to cross. And so what we're doing in the city of Miami is, aside from feeding people, which I think is imperative because unfortunately so many people have lost their jobs, can't work, and simply don't have food. What we're doing is we are also implementing 3 programs that today, by special meeting, our commission approved the 3rd, and they're incredibly important. The first is a rental subsidy and utilities subsidy program. We're not there yet. We're not quite there at the phase plan yet. We're not there yet. We're not there yet, Spencer. All right, no worries. I'll get you there. And I don't want to talk too long because I think the mayors both seem to be very judicious with the time, and I don't want to spend more time than I'm allotted. But the first thing that we've done is we set up, beginning on May 4th, a rental and utilities assistance program. So we're helping our residents have a bridge from now until we start entering into the different phases and the different openings in our Stand Up Miami plan. The second thing that we're doing is we have a micro enterprise grant program, and that's for companies that have 5 employees or less that do not qualify for PPP funding. And those are for, obviously, for different kinds of expenses that go beyond just PPP expenses, rent, and other kinds of business expenses. The other thing that we put into effect is a small business forgivable loan, which is $20,000. And that is essentially for people who have already received the PPP or could go along with the PPP in parallel with the PPP program, but pays expenses that the PPP program does not pay, like rent and other business expenses that are not related to personnel, to employees. And so we're doing everything that we can so that the city can make its determinations on the basis of the science, the data, our medical experts, and try to alleviate some of the economic pressure that our residents are feeling. These are unprecedented times. And what we've done, and now if you want, Spence, you can put it up. What we've done is we've created a plan, and I'm going to try to go through it very, very quickly because I think, I don't want to have a huge PowerPoint presentation, but our plan, obviously, as I said, has a very comprehensive gating criteria, which has been based on the federal government, the state government. And those were the three criteria that I basically talked about. The next slide, please. In all phases, we're going to be requiring our residents, obviously, to take these, washing their hands, using hand sanitizer, avoiding touching their face, obviously sneezing or coughing into a tissue or inside their elbow, disinfecting frequently, public surfaces, using face coverings while in public, staying at home if they're sick, and contacting their medical provider. In the next slide, we talk about some of the things that we've already done, and I've already kind of touched upon those, so we can go to the next slide. And the next slide really talks about where we're at right now. We still have an implemented curfew. We still have an implemented stay-at-home order. Next slide. Once we have reached that gating criteria, and once the medical professionals acknowledge that we have had these declining cases for 14 consecutive days, and the governor was very, very specific in his message yesterday, where he basically said that South Florida is not ready yet, and that's why his order didn't apply to South Florida, which I think was the right thing. We'll begin lifting some of these restrictions. Now, we're still internally discussing and debating some of these things, and I think that's one of the good reasons why it's important for us to come to the chamber and talk about it, because I think there was a question earlier to Mayor Gilbert about small gyms versus large gyms being in phase 3, and I met yesterday with a group of CrossFit box owners, and we're looking actively at that difference and seeing if there's a way that safely we can draw a distinction between small gyms and large gyms, and that's something that we're actively looking at. So, we are, some of these things are in flux, and if you go to the next slide, please. I think one of the important thing about phase 1 is that we start opening up businesses. Businesses will be open with a 25% occupancy capacity. And in phase 2, if we've met the gating criteria, which is the next 2 slides, we start opening up businesses to a 50% occupancy. And we open up restaurants, which we know is going to be an enormous challenge for so many of us. I mean, I think every government has struggled with what would those regulations look like. And obviously we've discussed a variety of things, from obviously requiring the employees to wear face coverings and gloves, to temperature readings at the door, to a variety of different things that can be implemented to make sure that it is safe. But I think it's important that as someone who was an asymptomatic carrier, right? I was asked to test without any symptoms. We don't know precisely how many people could be COVID-19 carriers that may not display symptoms and that could, threaten others in our community. I was very fortunate. I got tested asymptomatically, and that probably, because it predated some of the social distancing norms and some of, obviously it predated staying at home. I could have infected my family. I could have infected so many others in our community. And so one of the fears that we have in the city is obviously going too quickly and having a second wave of COVID-19 cases, which unfortunately would require us to go backwards. Everyone talks about the phase plans as if they're linear and they're always going to go forward. What very few people say is, if something doesn't go right in the phasing, if there is a reincidence, if something that we try to do doesn't work, we may have to go backwards. And people have often asked me, well, what has my experience taught me? It's taught me so much, my personal experience. One of the things it taught me was, I was an asymptomatic carrier. And so there probably are many of those in our community. B, I was case number 2. And we went from case 2 on March 13th to, in a month and a half to 12,000 cases in Miami-Dade County in a month and a half. When you look at the statistics nationally, we have 60,000 deaths in a month and a half. And that's with unprecedented restrictions in our country that we've probably never seen in terms of the stay-at-home orders and the social distancing. So imagine if those things were not in place. If those things were not in place, that number could be twice, 3 times as large, which completely dwarfs what the deaths would be from a flu in a given year, in a month and a half.
Mayor, thank you so much for that. We have several questions, and I know we have very limited time. We have a lot of folks that are asking about the Small Business Assistance Program, as well as the Micro Enterprise Assistance Program and the Emergency Rental and Utility Assistance. I want folks to know that this is an initiative by the City of Miami. This is not connected to the federal government. This is something that the city has taken to support their residents. I know that there's been a lot of frustration out there. Folks haven't been able to contact either their state or federal agencies to get help. So I really want to commend you on creating those and with the leadership of the City of Miami Commission and funding that program. But how can these folks sign up for it? Where do they go? Where can they get more information about that to get some help?
Benson, you can take off the presentation, Spence. Essentially on May 4th, we're going to have opening up applications at 9 a.m. and that is going to be on our city's website, www.miamigov.com, and also calling 305-416-2080, 305-416-2080. And obviously, there are 2 different programs. One of the programs is for people who have not received PPP help, and it's 5 employees or less. The other program is for businesses that could have received PPP loan money, but it's structured as a loan that could be forgiven if those businesses hire an additional person and keep that person on for the rest of the year. So it's a little bit of a stimulus package as well for our residents. We're obviously going to be focusing on getting our public sector projects moving as quickly as we can to stimulate the economy as we come out of this crisis. But as Mayor Gilbert has said, one of the things that we're concerned about, certainly as a major city and a dense city and a city with a high number of cases, probably the most in the state of Florida, is we don't want to do anything in a way that would bring us back to where we were.
No, absolutely. And I have to throw this out. Miami being the cosmopolitan city that it is, there's a lot of us that are in desperate need for a haircut and having to wear a hat all the time just to ensure that we're not growing crazy. I know a lot of my friends need their barbers and nail salons. These professionals are trained to be cleanly and follow health regulations. And I know a lot of them are facing very desperate times. Is there anything that you foresee in having them be limited operations, 1 person per studio? These guys need to work, and I need a haircut.
So look, gyms along with hairstylists, those are some of the hardest. And restaurants too present challenges because you're in such close proximity and in such close contact with people. But I think we will do everything that we can to develop rules where it's safe for people to get haircuts and be able to do it in a way that's safe. I mean, obviously, we're looking at what other cities are doing throughout the country. And what we don't want to do, and I think it's important, it's one thing if we have a difference of opinion on opening a park or a marina. It's another thing. What we don't want to do is create sort of competitive disadvantages. So we're hopeful that we can come together throughout these phases in terms of opening businesses and that our openings more closely mirror themselves, because we don't want a situation where customers will flee to somebody else just because one place opened quicker than the other. So I think it's important that we're coherent and cohesive on that.
So I'll take my Miami Trident hat off, but let's turn it over to Alfred. And
just a quick question. Thanks, Jose. Great job. Hey, Mr. Mayor, I wanted to welcome you, tell you we're so glad you're well again and back in the saddle. There have been a couple of questions that have been thrown up on the chat that basically says, look, it has to do with why are different governmental bodies having different regulations? The state says the whole state, but we sort of segment off, and then the city of Miami is saying, well, we're not going to go with the regs that the county is saying. Explain a little bit about that, and also related, and then how do you enforce it? If you have different regulations, how do you enforce that?
So I think there's a couple of things. The first is this is an unprecedented pandemic. And so there isn't a playbook, right? Everyone is doing the best that they can, understanding that at every level of government, there's huge differences, right? At the state, Miami is very different from Tallahassee and Gainesville and Ocala. I mean, they're just monumentally different, just like states are very different from each other. Then even in the county, you have unincorporated areas that are different from Miami, which is basically the densest, most metropolitan area in Dade County. So we have vast differences. And then look, let's be fair and let's be honest. We're not the same people. I mean, we have different ideas, different opinions. And look, I felt that it was important, and my commissioners felt that it was important to cancel and to cancel, to cancel Kyocho. And some people didn't agree at that time. And they have every right to express their perspective and their opinion. And, and then what happens, happens. And, we all have to live with our political decisions. Everybody has a right to make political judgments as they see fit and decisions. We've just been trying to be as conservative as possible because we know that, in the case of those events, those were massive events. In the case of opening, we've seen what has happened, in other parts of the country that have opened and people haven't respected some of the rules. So, we're taking our time. We're making sure that everything, that our criteria has been met, and we're letting the data of the information drive our decisions. And even the governor, like I said, was in his press conference yesterday, he's talked about how South Florida has to be different from the rest of the state. So, we hope that those differences don't get magnified because I think that, that's not the objective. I think our objective is just to keep our residents safe, and we'll get through this together.
That's right. One of the big parts of opening up safely is the personal protective equipment, the masks. Some argue whether gloves are necessary or not. Certainly the hand sanitizers. And there's a lot of questions of if we're all going to go out there and have to basically, provide these supplies for ourselves and for our customers and clients. What about the purchasing? Is there going to be a run on prices? How are we going to make these available to them?
I think, Alfred, it's a great question, and I think it goes to a broader problem, right? And let me tell you, and I'm going to answer it in two ways. Problem number one is, and I think Mayor Gilbert alluded to this, there is an incongruity, right, between the science aspect of this, the medical aspect of this, and sometimes running a functioning business. They're just not. They're two different things, right? So in the scientific part of this, you're going to promulgate some standards of you have to do this, you have to do that, and in the market you may not have that available. That's one thing. Another thing, and I'm looking at some of the questions, and Julie Grimes asked a very good question, which is that there is a discrepancy between the PPP program, which has an 8-week spend-off period, and our plans to open up our city, which can take as long as 8 weeks. Right, so those are just things that when Congress was funding the PPP program, they probably weren't thinking. But wait a second, cities that have stay-at-home orders and that have closed, they may not be open for this amount of time. So one of the things that we're trying to do is go back to Congress and say, look, you have to extend that 8-week spend down to 16 weeks, so that people have the ability to spend that down over a longer period of time, and not one size fits all. Like for example, restaurants usually have slightly lower personnel costs because a lot of people work on tips. And so but they have super high rent costs. They have a variety of other costs that are very, very high. So it's hard because one size doesn't fit all. But, we're going to go back and advocate for our businesses as much as we can.
Thank you.
Thank you. And I believe if we have just one more question, I want to talk a little bit personal. You, as a father of two very young children, running a city, and at the same time being one of the earliest cases of COVID in the city. Can you talk to us a little bit about your personal experience and how you dealt with that and keeping social distance? I know many of us are going to leave this time with being closer to our families, but also we have achieved amazing obstacles. So can you talk a little bit about your experience here?
I think there's two things that I think are gonna be huge takeaways from this place. So there'll be a lot more, but two that I think are enormous takeaways. The first one is precisely what we're doing right now, the virtuality of our life. I mean, you have 500, 600, 400 attendees right now that are watching this broadcast, and maybe many, many more. And I can at the end of this, I can leave the meeting, and it looks like I'm in my office, but I'm really in my laundry closet, and I can literally walk out and be with my family and hug my kids. I mean, the efficiency of that is so incredible. I mean, I can get off this and get on a Skype call and be on an interview across the country. I can be meeting with mayors across the country. I mean, there is just an incredible untapped efficiency that existed, but we had never tapped into. I think the second part that is, and by the way, of course, when I was in quarantine, that helped me make it, because had I not had these portals, it would have been hard for me to do my job, right? I think the second part that is very, very, very much a game changer is the fact that, we have prepared up until now for hurricanes. We prepared for, mass shootings, terrorist events. Other areas have had to prepare for earthquakes. All of those threats, by and large, are localized threats. This is one of the first threats that we've had to deal with, aside from the economic threat of the bubble bursting in the late 2000s, that has impacted everybody at the same time. So I think our eyes are open now to what a biological threat can do to paralyze our way of life, our economy. And I think just like Hurricane Andrew created a new normal for us here in terms of how we built our properties, and Hurricane Irma has created a new normal. And I know that Mayor Gilbert talked about resiliency and climatic resiliency. I think this is going to create a new normal in terms of our way of life and understanding how we need to confront a biological agent like this, which has been very deadly. And frankly, the next one could be even deadlier. So I think we have to be extremely, extremely careful.
And I think the biggest takeaway from what you're saying is that we here in Miami-Dade County and the city of Miami, we are a resilient community. We have seen everything from riots to hurricanes to now this, and really it is only through the help of organizations and leaders like yourself, like the city of Miami, like this Greater Miami Chamber of Commerce, that we're able to get out of the situation and continue to move forward. And this is another situation that we will move forward. And leaders like yourself have looked for solutions, have advocated federal and state partners in order to help these families. It's a very frustrating time. It's a very frustrating situation. There's a lot of small businesses that are in danger. And I know and I trust in your hands and the hands of the other mayors in this county that we're doing everything possible. And I want to personally thank you as a resident of the city of Miami for all that you're doing, Mayor, and for your leadership.
Thank you, Jose.
Thank you. Mr. Mayor, before you go, one last thing I want to say. Are you there?
I'm here. I'm still here.
Okay. There's been a lot of requests for you to please repeat the link for the resources, the phone numbers and link for the resources.
So there's two. One of them is our website, which is www.miamigov.com. We'll have a specific link to community development where you can apply online. And the second one is 305-416-2080. 305-416-2080. There's also in paper applications. It's going to be a 5-day application window. So from May 4th to May 9th, we're going to be potentially collecting up to 10,000 applicants. We're hoping to at least help 1,300 people in terms of the rental program. In terms of the small business, we'll do that up to the $1 million that we've allocated. And these are, again, unprecedented times. So I have seen a couple of the questions. I just wanted to address one is, where are we at? And I think I didn't hear Mayor Gimenez's presentation, but you heard Mayor Gilbert essentially say we're not certain where we're at in the sense of getting to phase one. We're still consulting with, the Department of Health. We're still consulting with our own experts, and we're analyzing the data that we're receiving to see when we feel comfortable being at phase one. I can tell you that the governor acknowledged that South Florida needs to go at a different pace from the rest of the state because of its uniqueness and the number of cases that we have.
Thank you. Well, listen, thank you, Mr. Mayor. Thank you, Jose, for your wonderful job moderating, and to Mark Trowbridge and all of our chamber sisters and friends. Really want to thank everybody for being part of this. Look, as we go on to open our businesses, we really hope that you will stay safe. If you are a small business and a part of the Greater Miami Chamber, you can go for help in applying and also in your PPP forgiveness to miamichamber.com/GMCC cares, and you can get somebody to help you right there. You have to be a member. Again, thanks for joining us, and we look forward to seeing you next week at our roundtable.